We begin with disturbing reports from a COVID-19 patient in isolation at a major government hospital, painting a grim picture of life on the COVID ward. The patient, whose identity is being protected, also described the food and accommodation as horrible, adding that people of unsound mind are also being housed on the ward. Now, while commending some doctors and nurses at the hospital, their colleagues at another facility are being accused of discrimination. Andrea Chisholm was speaking with the patient, who is frustrated and emotionally drained.
Life in isolation for one COVID-19 patient we will call Daniel has not been easy.
Oh my God. I thought I was like being in an area by myself. No, it's a regular ward with 6 beds in one area. There's men and women using the same bathroom. It's just all sorts of people with unsound mind and all sorts of crazy things, and they're using the same bathroom you're using. You have no privacy. There's no curtains around your bed. You're not allowed to go anywhere more than walk around your bed. Yes, you stay away from each other and all of that.
But how did Daniel get there? The patient was one of those who arrived in Jamaica close to the end of March, adamant they would stick to the 14-day self-quarantine rule. Midway into the quarantine,
I start experiencing cough with just a speck of blood. So I got alarmed and I ended up calling. But the number that rang in my head at first was the 1-800 number. When I called the 1-800 number, I explained to her what I'm experiencing and what they have told me to do and stay home. She advised me that I should go see a private doctor. So I was annoyed at that point. I said to her, how can I see a private doctor when they already advised me to stay home?
Since the call center operator was unhelpful, Daniel reviewed the paperwork received at the airport and called another number for the health authorities. Daniel was picked up, taken to a hospital, and was told by a health worker to go inside a room.
I said to her, the room is pitch black. How can I stay inside there? No windows. There was dirty mops in bucket. There was the ventilator stuff that you put around the face in bucket with water. There was, I have pictures of it. There was garbage bins with, with the red bag in it. I don't know what that indicates.
After hours of waiting,
I went to the emergency area because everybody was scanning me as if I had leprosy or something. I don't know. So I haven't got tested yet, but they were basically just making me feel real uncomfortable. So I went to the emergency area where normally the nurses are and doctors.
By that time, Daniel was in tears, overwhelmed and scared. 4 days later, bad news. The COVID-19 test came back positive, and Daniel was taken to another hospital to begin the isolation journey.
Sometimes you get bread and jam, bread and peanut butter. I don't go well with wheat, period, and I just don't eat it. I just basically just drink some Gatorade or something. The food is basically, the rice is hard. It's not good. It's really not good.
So you don't get no fruits and vegetables and stuff like that?
There's vegetables inside the box and a slice of melon. Yeah. Yeah, that's about it.
What about the treatment from the doctors and nurses?
The doctors and nurses are very supportive. They are lovely. I mean, like, they have been keeping my energy up and encouraging me. Yeah, they are the best, to tell you the truth.
Daniel has not been showing any symptoms and is anxiously awaiting the results of another COVID-19 test, hoping for it to be negative. All Daniel wants is the all clear to be discharged and to reunite with the family. Andrea Chisholm, TVJ News.